assessments to lead from wreckage. The first medical responders have arrived at the scene and have begun to assess the situation.
Somebody help me!
Stay calm, ma'am. Tell me your name.
Brooke Belton, Scott.
Can you tell me anything else you're feeling?
I'm feeling a little bit sick.
The first responders have been issued a triage tag in the disaster PIN 2.0. All those performing the triage should have a PIN, especially the EMTs and firefighters. After using the barcode reading technology on the PIN to scan the triage tag, the first responder scans. Okay. He takes a picture of the patient's face and then begins to take in the patient's basic information immediately. He records the information such as the name, the address, location found, and the age. This process can then be completed by also with an iPad, an electronic version of the assessment form available on a stripped-down disaster version of the iPad.
Are you looking for anyone, ma'am? Is there anyone traveling with you?
That's right, my mother was with me, but I'm not sure where she is right now.
The first responder takes the information about who the patient was looking for. This, along with a picture taken by the patient, is then sent to the command center and relayed instantly to the Reunite database so that those involved in the disaster can be tracked and identified by the relevance.
I'm going to make sure you get to the hospital right away, ma'am. Get the right treatment.
The first responder makes a triage decision and records it on the form along with a basic assessment of the patient's condition.
The form is going to stay with you, ma'am.
Okay, I understand. Thank you.
In case an internet connectivity is down, and due to the conditions of the disaster, the physical form will stay with the patient as a backup. The triage form also contains an RFID transmitter that can be used at low ranges of 100 meters to locate the patient.
Our next scene is sometime later at the local hospital, which also contains the command center. Data within reach of the hospital's uplink computers has uploaded automatically in real time to the command center. Data outside of this area will be uploaded by dock to the pen after the shift. Information reaches the command center and is disseminated to Command, Wiser, and Reunite. Command receives information on the raw number of patients and relative critical nature of those patients at each hospital or clinic. They can use this information to allocate resources, determine the substance release, and in turn disseminate information on that substance to the hospitals. Check marks against symptoms send queries to Wiser and determine the type of contaminant. Terminology from the forms is chosen explicitly to match Wiser terms for a wide variety of possible outcomes, so not just this particular exposure. Reunite receives photographs, name, age, sex, and status of the patient and their missing associates. The doctor speaks.
Looks like we've got about 30 patients en route with moderate to severe symptoms of ethylene exposure. They've been decontaminated at the scene, but we should have lots of atropine and pralidoxin on hand for treatment. Remember guys, have your vests on and safety first.
Clinicians performing triage in the hospital should have a pen. The emergency data collection point is structured to match up eventually with the hospital's EHR and find known patients wherever possible.
Vic, I've got some information and medical background already, along with your symptoms from the scene of the crash. Have you started experiencing any other symptoms since you arrived?
Yeah, I'm having trouble seeing clearly. My vision is fading. Am I going to die?
We're trying to stay calm. We're going to help you. Looks like you've been exposed to ethanol, and we're here to provide you with the best treatment possible.
The hospital responders form to use the Disaster Pen 2.0 has some fields already automatically completed from the scene of the disaster. The second form contains more in-depth information and is used primarily to transmit key information to the command center and the EHR system.